Hi everyone, my name is Luyando Allen. So today I'll be discussing older adults and homelessness. So the definition of homelessness is individuals or families as lacking a fixed, regular, and adequate nighttime residence, including persons residing in emergency shelters or places not meant for human habitation. In 2009, Congress expanded the definition of homelessness to include individuals at imminent risk of homelessness as well. So the U.S. is graying. By 2050, there's expected to be 95,000 elders or older adults living without stable housing. So there's no set age of who is defined as an older adult. What I have found from my research is that when older adults in homelessness is considered 50 and up. There has been an upward trend in the population of homelessness among people that are the ages 50 to 64. We don't see as much for people 65 and up, and that is believed to be because there are some social safety nets that assist those 65 and older to have housing. Some of these safety nets are senior subsidized housing, which is available to older adults at the age of 62. There's Medicare, which is available to older adults at the age of 65, and also Social Security benefits, which is also available to older adults at the age of 65. Our population, older adult population, is rapidly growing, and so will the population of homeless older adults. Every day in the U.S., 10,000 people turn 65. Can you imagine that? Which is why we see a rise in the number of homeless older adults. Because some older adults have been chronically homeless and they're just aging in place. And then there are some older adults who are becoming homeless for the first time in their golden years. People 50 and older make up more than 30% of the homeless population. And that number is steadily increasing, that percentage. So you may be thinking to yourself, well, why is all of this happening? Allow me to explain. Housing has become unaffordable. 1 in 3 older adults faces a high housing cost burden, and 1 in 5 experience a severe cost burden. In 2010, the monthly Social Security income payment for an individual was about $703, which is well below the poverty line. And if you think of areas like Philadelphia, California, those areas, the cost of living is even higher. So imagine living on $703 per the whole month. So there was some research done which found that a person receiving SSI, Social Security Income Support, would have to pay 112% of their income to rent a one-bedroom apartment, or 99% of their income to rent a studio or efficiency apartment. Now keep in mind that SSI is not intended just for housing, but to supplement the cost of other basic needs. And older adults have higher healthcare costs than other age groups. And so depending on their age, for example, those who fall between 50 and 64, they do not yet qualify for Medicare. Even though with Medicare, there is the older adult is still liable for cost sharing for things such as premiums, deductibles, and copays. And Medicare does not cover or has usually limited coverage for things such as dental. Seniors at some point generally need dentures. Those cost quite a bit of money. Hearing. Seniors, older adults sometimes have issues with hearing and may require hearing aid, and those are costly. And then there's vision services, and those things may not be covered as well, and those are also costly. And those services are not covered by Medicaid either, which if an older adult meets the income limits, they can get Medicaid, but there's still coverages that are limited. The average older adult pays $4,734 per year in out-of-pocket Medicare costs. This is 3 times more than a non-Medicare household. And as I mentioned before, older adults can be on the senior subsidized housing waiting list. But generally, this is 3 to 5 years, which means that for every one occupied unit in the U.S., there are 9 older adults waiting for that unit. Being homeless brings about risk for the older adult. Older adults face barriers to access health care. This population tends to have more chronic illnesses that could actually be treatable, but they tend not to seek out medical treatment because they may believe that they won't be treated appropriately by the providers, or they also think about financial considerations because they may not be able to afford the care they need. And that could be something that we as social workers work to advocate for them, or to help break down these barriers, to help homeless older adults access the health care that they need, because that also puts them at risk for premature mortality from illnesses that could be managed with proper care. There's a stigma with homelessness, which is also another reason why older adults may not seek treatment. And generally you'll see increased numbers of hospitalizations for this population. What can we do? We can support permanent supportive housing programs, which are programs that have on-site or closely linked supportive services for people that are chronically homeless. These services may be providing access to medical care, psychiatric care, personal care, which is big for older adults because generally in your standard shelter, it does not account for physical limitations that the older adult may have. Homeless people are unable to modify their physical environment to match their physical limitations, such as walkers or glasses, to helping them obtain these things and be able to keep them. Which, like having bunk beds in shelters or shared bathing facilities, which may put the older adult at risk for falls or injury, which is a cycle back to the hospital. And then they may be re-victimized, So personal care would assist with bathing and dressing, which are activities of daily living. And they may also have supportive services such as case management, vocational and substance use counseling and services. Also doing outreach, because older adults may have limited mobility. Also, homeless people in general do not tend to seek out treatment or clinical support because they are pursuing survival. So a lot of the treatment must take place in non-traditional settings such as shelters, emergency rooms, soup kitchens, the street, parks, transit terminals, where we as social workers can create opportunities in public settings to interview and evaluate underlying interests and problems that we may be able to assist the older adults with, because one of our ethics is that we have a duty to serve and to reduce the barriers that the older adult may be facing. It may be something as simple as helping them apply for services, helping them apply to get on the waiting list for housing. And we must also advocate for this group because, for example, where we see the most older adults facing homelessness is the age group 50 to 64, and there are limited services out there for them. So we as social workers can advocate for policy change that would include that group to reduce the numbers that we're seeing, because these numbers are rapidly growing, and as the population increases, so will the number of older adults who face homelessness. It's important. There's stigma with homelessness, and it's important to treat each client, each older adult with dignity and respect, and that we provide them the best care. As I discussed, providing service to the older adults and social justice, because this is a vulnerable population. They're vulnerable because of their age, and also they may be vulnerable because of their age, physical limitations, mental health issues. There are a lot of factors, and they deserve to have a voice for them, and that's where we as social workers come in. I hope you guys learned a lot today. Have a great rest of the summer. Thanks. Bye.